Let me now set out the additional measures that we are proposing. The measures on hospitality are intended to be in force for 16 days, from this Friday at 6 p.m. to Sunday the 25th of October, inclusive. In other words, across the next 2 weeks and 3 weekends. So firstly, with the exception of the 5 health board areas I will talk about shortly, pubs, bars, restaurants and cafes will be able to operate indoors on the following very restricted basis only. During the day from 6 a.m. to 6 p.m. for the service of food and non-alcoholic drinks only. Hotel restaurants will be able to operate beyond 6 p.m. but only for residents and without alcohol. The reason we are not closing indoor hospitality completely is that we know the benefits in terms of reducing loneliness and isolation, of giving people, particularly those who live alone, somewhere they can meet a friend for a coffee and a chat. But the restrictions will be strictly applied, and all the current regulations and the limits on meeting a maximum of 6 people from 2 households in indoor public places will still apply. Again, with the exception of the Central Belt areas I will mention shortly, bars, pubs, restaurants and cafes can continue to serve alcohol outdoors up to the existing curfew time of 10 p.m. and subject to the 6-2 rule on group size. There will be an exemption to these rules in all parts of Scotland, Presiding Officer. It's important to stress this, for celebrations associated with specific life events such as weddings that are already booked and funerals. The current rules for those will continue to apply. These are the new measures that will take effect nationwide. However, because of the significantly higher levels of infection in the Central Belt, we are introducing stricter restrictions in the following 5 health board areas: Greater Glasgow and Clyde, Lanarkshire, Ayrshire and Arran, Lothian and Forth Valley. We estimate that the number of new COVID cases is currently growing by around 7% each day. So without action, and this is perhaps the starkest warning in today's evidence paper, we are likely to return to the peak level of infections we had in the spring by the end of this month. It is to interrupt that trajectory that we must act now. Of course, we have already taken perhaps the most important and certainly the most painful step we can to reduce transmission. For the last 12 days, apart from certain limited exceptions, we have not been able to meet up in each other's homes. That should already be making a difference to infection rates, even if, because there's always a time lag between introducing new measures and the impact they have, we're not yet seeing it reflected in our figures. And let me take the opportunity to emphasise again today how vitally important it is that we all stick to that rule. It's incredibly hard for all of us not to visit friends and family or have them visit us, but it is the single most effective measure we can take to stop COVID passing from one household to another. So please stick with it. That measure is vital, but the clinical advice I have received now is that it is not sufficient. We need to do more and we need to do it now.